We tell ourselves a very specific story about mental health care. The assumption is that professional therapy costs a fortune, an out-of-pocket luxury reserved strictly for people with plenty of disposable income. We construct this internal narrative about what help actually costs. It becomes a running script in our heads, quietly insisting that sitting down with a weekly therapist is completely out of reach. The result is that people sit quietly with heavy burdens. They try to manage severe anxiety, creeping depression, and deeply rooted trauma entirely on their own, convinced they have no other choice. It operates as a form of self-gatekeeping. The fear of receiving a massive medical bill is so strong that most people actively avoid checking the actual prices. But what happens to that paralyzing fear when we stop guessing and actually look at the objective financial data? For millions of people, the primary roadblock to mental health treatment isn't their bank balance. It is simply the untested assumption of an astronomical invoice. To see how the numbers actually work, we can look at a modern telehealth practice like coping and healing counseling in Georgia. When reviewing billing records, a professional therapy session is often cheaper than takeout. This chart visualizes out-of-pocket costs. Georgia Medicaid covers behavioral health with a $0 copay. Standard networks like Aetna, Cigna, Blue Cross, Humana, and United Healthcare cap between $10 and $40. Annually, many plans cover 20 to 40 sessions, or even unlimited access. Even without insurance, there is a structural safety net in place. Clinics offer sliding scale payment options and actively assist individuals in exploring their Medicaid eligibility. Utilizing modern insurance networks turns professional mental health care from an exclusive, high-end purchase into a highly manageable monthly utility. The direct fee is only one part of the equation. Therapy comes with hidden logistical costs, like taking hours off work and paying for a physical commute across town. Practices like coping and healing counseling eliminate these secondary financial drains entirely by operating a 100% HIPAA-compliant telehealth model. Looking at this map of Georgia, we see exactly how geography is removed as a barrier. The practice systematically serves all 159 individual counties across the state. This statewide coverage instantly connects patients to a culturally competent team of over 15 licensed specialists, including clinical social workers and marriage and family therapists, regardless of their local zip code. Still, there is one final administrative roadblock holding people back: the sheer anxiety and confusion of deciphering a dense personal health insurance policy. To clear this friction, their administration team conducts complete, free benefit checks before a patient ever commits to scheduling their first appointment. True accessibility requires dismantling both the financial invoice and the logistical red tape of finding a therapist. The infrastructure for specialized, culturally competent, and deeply affordable mental health care is already fully operational. The obstacle preventing treatment is rarely the healthcare system itself. It is the public's outdated perception of how that system works. Removing financial anxiety triggers immediate psychological relief. It frees a patient to direct their energy toward actual healing, working through grief, managing their stress, and repairing relationships. Stop letting an untested assumption about the cost block your access to personal growth and stability. It is time to end the habit of self-gatekeeping. Let the professionals at Coping and Healing Counseling run the actual math on your coverage. Start the process and remove your cost barrier today. Reach out for a free benefit check at chctherapy.com or call them directly at 404-832-0102.